Your pregnancy or giving birth is one of the most important things that you'll do in your life, and from the moment that you're here, from labor and delivery to you step out of the door and even after, the care that you receive is more than anything. It's important because it's the care of your child. Phoebe did that for me without any doubt. I would not have chosen any other place. I'm glad that this is where we were, that we had the nurses, the team, the doctors that we did, so that the experience was a good one for us and my family as well.
The quality of care someone should expect to receive when they come to Phoebe should be second to none throughout the region, and is able to take care of really any situation that may come up with a pregnancy and delivery.
Safety is a huge issue. In this day and age, we've gotten so good at what we do with so many aspects of maternal fetal care. Sometimes we lose sight of the fact that safety was what took mothers to the hospital in the first place, and safety should be the concern today for both the mother and the baby.
You can see on a daily basis the value of having quality support services such as an NICU available. On a seemingly uncomplicated delivery, one can develop bleeding problems, one can see respiratory distress, one can see a difficult delivery where a large baby might get hung up in the birth canal and necessitating immediate resuscitation and care by expert personnel, of which this perinatal center here is able to deliver.
Well, this is my third pregnancy, and all of my prenatal visits went normally, all of my screenings were normal, so everything was going great. He was due on October the 3rd, and he didn't come on October the 3rd, so we had to induce labor. So I think it was October the 11th we went in actually to start the induction procedure. In the process of him being born, he aspirated a little bit of his meconium. So because of that, the NICU was in the room within minutes. And they took great care of him and said that they'd rather take him down to the NICU than release him to us at that time to just have some further tests. We were able to go from our room and be at the NICU within minutes, and that's very comforting knowing that you're just, a floor away basically. So to us that was very important.
When Mom comes down to the unit, we include her in the care. She gets to help feed the baby, bathe the baby, change the baby's clothes and diaper. We encourage our parents to be hands-on. We encourage them to come and stay at the bedside as much as possible, to call whenever they can if they may not have a ride to the hospital. So we really think it's important, and it does help the babies get better to have parents involved with their care.
Because we're a regional referral center and serve the 23 counties that are around us, we have a large number of patients who are born in outlying facilities and the baby is then moved to our facility. That creates a very special situation for the parents because, especially the mom, she's usually an inpatient in a hospital and has her own health issues to deal with at that particular point in time. So that separation anxiety is very difficult for her. For the other members of the family, they're then brought to Phoebe where they may have arrived for the first time. And so it's very important for us to help them feel comfortable in what is now a strange environment to them, strange people. The doctors and nurses that they've bonded with at their other hospital and they feel very comfortable with are no longer there for them. So we have to very quickly make them feel at home.
I did have a pretty easy pregnancy. I started going to the doctor when I was about 6 weeks pregnant. Everything was normal, no hypertension, no problems, no issues. My water broke Christmas Eve, went into labor. I had a normal delivery, everything was fine. But my daughter did not pass her first bowel movement. We were packed up, ready to go, actually 1 foot out of the door, getting ready to walk out. And the pediatrician decided that she needed to come to the NICU unit. I was a mess, as you can imagine, not knowing what was going on with her, what the outcome would be. But everywhere I looked, there was someone there it's gonna be okay, and you're in the best place there you could be, and she'll be fine. And I had no worries after that initial conversation with the nurses.
Whenever I'm addressing any group of people, I speak from the standpoint of safety for babies. Because babies traditionally do not have spokesmen. And as you look around in this unit, you see people who devote their whole life to the safety of the baby. And so while we think it's important that mothers have very nice rooms to have their babies in, and nice rooms to have their family there and their other support structure there, we look at that as something that is just really nice to have. But what you gotta have is you gotta have safety. And that's the final bottom line.